Well, hello. Welcome to our makeshift ICU. So the ICU, or intensive care unit, can be a scary place for fieldwork students or even new grads. With all the things that can go wrong, like line management, stay down, all the crazy sights and sounds, it can be intimidating. But we know that early mobilization is very important for patients to get up and moving and out of the ICU quicker. So follow us along on this journey, and remember, put on your OT glasses.
Oh, I guess this is it. Hey! How are you doing today?
I'm okay.
Well, my name's Rachel, and I'm going to be your therapist.
Okay. Hi, Rachel.
Can you tell me a little bit about what's going on?
I have pneumonia, and this is like my third time coming, and they don't know what's the reason, but I'm completely exhausted.
Okay. Well, have you been moving at all?
To be honest, I can't remember. Maybe not.
Well, have you been out of the bed since you got here?
No.
All right, well, we got to get you out of the bed.
Okay.
So, if you'll just come towards me.
Like now?
Yeah, let's do it.
What, are you gonna help me?
Well, I will if you need me.
Okay, I don't feel safe.
Bring your legs towards me.
Like right now.
Yeah. That's it, you're moving them.
Yeah, but it's hard.
Yeah, that's why we have to get up so quickly. Here, I'll help
Are
you a
you
little
sure?
bit.
Okay. Are you sure this is safe?
Oh, yeah.
I don't know.
Trust me, the other patient that I just came from, they did just fine.
The therapist proceeds to transfer the patient from the bed to the chair. But what is she forgetting?
That's our.
Is that it?
Yeah, you said you were kind of tired, right?
Yeah, I'm exhausted.
Mhm. All right. Well, I'll come back and see you.
So I'm staying here?
Yeah,
Oh, okay. Cool.
we don't like you to stay in bed all day.
Oh, okay, well, thanks.
All right. You have a good one.
Prior to the evaluation, the therapist does a thorough chart review of the patient and gets an okay from the patient's nurse to proceed with treatment. Upon arrival to the patient's room, the therapist recognizes the droplet precaution sign and dons the correct personal protective equipment, as well as cleans her hands with sanitizer to ensure safety for all parties involved. Hi, Miss Braxton.
Hi.
How are you doing today?
Well, and yourself?
Okay. What brought you here?
Well, I have pneumonia, and so this is my third time being admitted into the hospital, and it's the same thing, but we don't know exactly, what it is and why I get so sick so frequently. We know it has to do something with my immune system, but we just don't know, the cause or the root of it.
The therapist uses her therapeutic use of self to engage with the patient and perform an occupational profile. This portion of the evaluation is where the therapist learns about the patient's prior level of function, life roles, occupations, leisure activities, and goals for after hospital discharge.
I just called nursing.
Well, I just unkinked it for you, so it should
Oh,
be
okay,
good now.
cool. Awesome. Thanks.
Have you ever had an occupational therapist?
To be honest, no. What do y'all do exactly?
So we are all about making sure you have the best quality of life that you can, and that you are independent with the things that you want to do. And
Right.
we usually in the ICU focus on getting you moving
Okay.
and just your basic self-care. Yeah, so have you been up at all?
No, I have not. And I don't know. I just feel so like lethargic. That makes sense.
Yeah, that could be some of the medication, but
Probably.
your stats are looking good. But let me check that blood pressure, because I saw on your chart where your blood pressure was running kind of high.
Yeah.
Is that usual, or is that a
When I
little
get
different?
sick, it is.
Okay.
But usually it's pretty good.
You look pretty good right now.
Okay.
Would you like to sit in a chair?
I don't know. I guess we could try.
Well, we'll just see, and if you can't,
Okay.
we'll just do some other stuff. Does that sound all right to you?
Are the IVs gonna reach over there?
I'm gonna get them fixed up.
The therapist moves the IV pole closer to the targeted transfer site and untangles it. She then instructs the patient to perform a supine to sit transfer, giving verbal and tactile cues as needed. It's important to note that the bed in this video is acting janky, but in a real ICU, one would raise the head of the bed if the patient was having difficulty performing the transfer.
How are you feeling?
A little dizzy.
Okay, well, we'll just sit here. We got plenty of time. So, what I want to do is check your blood pressure. Just one
Again?
more time. Just because you're saying
Oh.
you're getting dizzy.
Oh, okay. That's
Alright.
actually relatively safe inside.
Yeah, we'll just relax your arm.
Okay.
Okay. It's still looking okay for right now.
Alright.
Are you feeling short of breath or anything? I'm gonna just check your oxygen. You've done this before, I can tell.
Yeah. I'm so used
All
to
right,
this
so that's
place.
looking good. Okay, can you scoot towards me and put your feet on the floor?
Okay.
If you need some help, I can help.
Whew. Okay, I'm tired.
Okay, well, let's take a breather.
Okay.
You're doing great.
Yeah, I wanna be able to do this on my own, you know?
Mm-hmm. Oh, yeah. So, I see you have your shoes over here, so we're just gonna try to put those on so that when we stand up, you won't slip and fall.
This time, the therapist puts on that handy-dandy gait belt to avoid a fall. She then sees if the patient can independently don shoes, being ready to give assistance if needed.
Are you feeling all right?
Yeah.
Are you sure?
Maybe I don't know, maybe I should have got some more shoes.
Yeah, we like to suggest some slide-on shoes because they're just
Yeah.
a little easier to get on.
Maybe I should have done that.
But you're not looking so good. Let's check your blood pressure.
Okay. Yeah.
I don't want you to overdo because it's important to be moving and active, but we don't want to overdo. Okay. So are you feeling dizzy now?
A little bit.
Okay. So your blood pressure's gotten a lot
That's
higher.
like usual, right?
No, we don't. When you're dizzy like that, sometimes it can mess up your balance. And when you have high blood pressure and you're dizzy, we don't like to get you moving too much.
Okay.
And you've been moving a lot,
Yeah.
especially for not being so active as you usually are.
Right.
So what we're gonna do is we're just gonna sit down and we'll just do some activities in the bed. Does that sound all right?
The therapist uses clinical reasoning to determine that a transfer is not safe to perform at this time. She then modifies the activity to bed level.
I always like to ask people if they've had a chance to brush their teeth today.
No,
Is that something that you would like to do?
sure.
The therapist gathers materials for oral hygiene to be performed in the bed. Again, the bed in this video was broken, but in the real world, you would raise the head of the bed or try to find a wedge or pillows to prop the patient upright to avoid aspiration.
Is there anything else you would like me to work with?
No, I think I'm good, actually.
I look forward to seeing you. It was nice to meet you.
Nice to meet you too.
And I hope you get to feeling better.
Thanks.